Hi, Chris. Okay, so here we are. We're going to break this down, and I'm going to pretty much tell you where the deficiencies are and what is it that we need to improve and open up, which is going to be in the first program. The first thing that I see is when you turn around, you take a step, that leg, that right hip, if you see it right here, it swings and compensates. And as I go and we see it more, you're going to see it more on the ankle. Pay attention to your right foot. The right foot is more planting on the outer aspect versus the left foot. You're actually driving with that big toe. So you see how that pushes off. When you land on your right one, it's a little externally rotated out, and you're planting more with the outer aspect of your foot. You see how it's already kind of like pointing out that way, and this one's a little bit more straight, right? Um, that's number one in the aspect of correcting this is that we have to tackle that ankle and open that ankle mobility, which I already saw the ankle mobility, and it's something we definitely have to improve and loosen up those calves a little bit more. Now, see it from the front view, you'll see it a little bit more right there. You kind of like swing that right leg around, it kind of externally rotates, pointing out, and then you bring it straight. But then it pivots out. If you kind of see that little subtle movement that goes over to the back heel, kind of externally, and you'll be able to see it on the squat as well. That one pushing off the big foot. Right there was another one. You step, pivot, step, pivot. Right, and that all is affecting your hips as well, and that kinetic chain up that body, and just really really sticky. Obviously in the hips in the area, as you can tell when you were walking. All right, now moving over to the lunge. Here, what I see is when you step, I'm going to let that pause time move out of the way. But you could see how you're pushing a little bit more out, and this hip is being pushed out as you're landing. You can't see it. You'll see it from the front view when you're walking backwards. But as you can tell, that big toe is now being planted, and big toe drive is super important. And you see that little unstable. You could already see that knee caving in, which you'll see it from the front view. Another one here. So when you step forward, hip is elevated, right? Look at the hip elevation. That's just because of tightness in this area here, weakness as well. Boom. You see that little correction that you do with your heel? That's what I was talking about when you were walking just normal. It pivots, boom, out, externally rotated. And that's just due to the fact of tightness and the stickiness that we have coming up from the hip. But we need to be able to get that better ankle mobility. Let me play it from the front. Perfect example right here. Boom, knee caving in, under. That's telling me really tight hips. The QL, which is the back end of the muscle where you're super sensitive when I was doing therapy, is really tight still. I know you told me you're feeling better, which is great. I'm glad you're doing all the mobility. Definitely need to get that outer glute a little bit more stronger to help you stabilize through that knee and down the foot as well. But a lot of things is going to correct by getting the hamstrings and the posterior chain a lot stronger. This one's caving in as well, as you can tell. Both of them need to work, but you have better toe drive through your left foot versus the right foot. So stuff that we're definitely going to correct. All right, moving over to the side lunge. From what I saw here, I'm paying attention more to your knees. And definitely a little tight through the adductor part here in the inner thigh muscle on the left side. But more what I notice is look how much higher this hip is compared to this one. And you can see by the knees. Okay. It's a little bit more elevated, which in essence it's affecting how tight that left side is, which is we already knew. And when you take a step here, you kind of detach that ankle off the floor. The shoes don't help. That's definitely causing more imbalances. I don't mind you using those shoes if you're walking, but if we're training, I would love for you to train barefoot. We have over 10,000 nerve endings on the bottom of our feet. I want you to feel. And I could already see this ankle, which we already knew, it's collapsing more to the right. And if I move that, you see how that foot's already tilted more externally rotated. So these shoes, you know, are great and they're comfy and I encourage it, but we got to correct things first so that way when you are using these shoes, you are moving the correct way. And as you knew, a little bit tight in the hips, you can see that pelvis going into more anteriorly, pelvic tilt. So something that is being corrected. But like I said, main thing that we need to correct is the ankles. Not bad on the lateral. You're definitely properly hinging. You've been in the gym for quite some time, so understand what hinging is. And that looks pretty good as well. Like I said, the inner thigh is a little tight, not bad, but it's more the anterior aspect for sure, and those ankles, that right side, that we need to open up a little bit more. Okay, this is really me seeing the external and internal rotation of the shoulders. And I can see it's really, really sticky when it comes to the shoulders. When you rotate down, you kind of like elevate the shoulders up. Elbows get pointed up to the ceiling before you're able to bring those arms down. So definitely dealing with a lot of tightness in the anterior aspect of those shoulders. And you can kind of see it here. When you keep it here, in order for you to bring your arms and then external rotation, those shoulders and that scapula needs to be elevated to go down, when in reality we should be able to just lay our hands flat on the shoulder without really elevating anything in our shoulder region for us to do extra internal rotation. And then when you bring it back, boom, it kind of like brings you forward. You see that stickiness? If I let it play through, boom, it kind of has that restriction. So arms go down and they kind of go forward again, just because it's really fighting you when you're trying to do that movement. When you reach up, not bad, but definitely have to open up that anterior aspect in order for us to gain good range of motion. This one, can't see much. It looks good, just looking flexion, extension of the elbow. It was more so you touching the top of your shoulder and extending, but it gave me enough information for me to put on the program what we need to work on to open that area up for you. Okay, this one tells us a lot more for sure. T-spine rotation. We need to be versatile in us to do rotation. Anytime that we do rotation or anything out of the normal when we're walking straight up and down, which is normally what a human being does day to day, we never train, or most people don't train lateral rotation of the spine. And that's when people get injured. So, thing that we already discussed, right? That knee's caving in. And you can see as soon as you go down, that knee is caving in and the hip is shooting out. Okay, that's one thing. The other thing is, when you're trying to do the rotation, and I know you said this sucks in the video, right there. Right, we're definitely dealing with restriction where it's not allowing you to rotate and you're actually moving your hips the other way. If you pay attention here, in order for you to be able to do that rotation, we got to be efficient to do spinal rotation without moving the hips. And that's how we're going to become a more versatile human. Same thing with here, the knees caving in, but not as much as the right side. It still needs attention, but this side you're definitely more limited because you're using the right side to able to pull you this way. And since the hip is so sticky, it's pulling you back inside when you're trying to go the opposite way, which is why you're so more limited to go to your left. So all things that we're going to tackle are going to be in the program, and I'm excited for you to start. The next thing that I'm going to show you is the ankle mobility. Let me see if I can center it to where we can see your ankle. Okay. So the first things first, right? When you push, ankle is the heel is coming off the ground. That's the only way you're able to touch the wall. So, restriction, and that's due to I know we do, and that's just because we've done therapy, tight gastroc, tight calves that we need to open up. The other side, not as bad. It still comes up a little bit. Not as bad. This one you keep a little bit better. So ankle mobility definitely on both. But if I see it from the upper body aspect, on that heel coming off and gets detached, right? Now I'm paying attention a little bit more to your hips. So when you plant and you push forward, it does detach actually a little bit there now that I zoom out. But you're actually moving the hips a little bit too much forward to be able to go to the wall, when in reality it should just be the knee and your chest should stay a little bit more upright. So, we're going to work from the ground up. That's going to help you with our knee cave in, get those areas to open up a little bit more. In the first phase, it's going to be nothing but introductory phase, just to get those areas that need to be more mobile to open up, and then strengthen the opposite muscles that are not firing up properly to help you get proper alignment and get you out of pain. So excited. Let's work.